Hello, warriors. Hello, healers. Welcome back to this episode. I hope you guys are loving the content lately. And these content are inspired by questions that I get from my patients, and also prospect patients, right? Because the goal is to really give you information to help enhance your knowledge and your skills so that you can use the information to make better decisions when it comes to your health, when it comes to your wealth, when it comes to your wellness, so that you can live a fulfilling life. Okay? If you're new to my podcast, the Prepare Patient Podcast, or you're watching this on YouTube, my platform, Dr. Jennifer Genty, I want to welcome you and I want to say thank you so much for taking time and energy out of your busy schedule to watch this. I so appreciate it. And I'm also going to ask that you share this episode with all the people that you love. Let them know there's a doctor that's on a mission, a functional medicine doctor that's on a mission to empower them, motivate them, and give them the information that they so desire, they need to help them stay healthy and address any health conditions and symptoms, or get the information and bring it back to their own doctors and help and get help and help the doctors help them. Okay. So my name is Dr. Jennifer Genty. I am a functional medicine doctor, meaning that I help my patients address digestive issues, all digestive issues, gas, bloat, constipation, diarrhea, colitis, acid reflux, abdominal distension, weight gain, that's also a digestive issue. I help them address those issues naturally. I also help my patients balance the hormones, premenopause, perimenopause, postmenopause naturally, and also, as I mentioned, lose weight without taking a pill or injecting themselves with toxic ingredients. If that sounds good to you, I would love for you to subscribe. So I'm going to bring you so many content. This platform is going to be about my life as I'm living my life as a functional medicine doctor. I'm going to bring you behind the scenes in my clinic. I'm going to take you behind the scenes of traveling with me. So if you want to see this content, subscribe so you can get notification when I release a new video or a new episode. All right, so I got a question from a patient, and the question states, Dr. J, what is the organ that you focus on the most, right? Dr. J, what is the organ in your body that you focus on the most? And it came to be a surprising answer because most people will probably think that I'm going to say something else, like my gut, my stomach, my small intestine, my large intestine, or maybe my skin or my brain. Or no. The organ that I focus on the most is my liver. Yes. My liver, Liver. Did I spell it right? My liver, my friend. Yeah. I feel like the liver is the most misunderstood, neglected organ in the body. And there are multiple reasons why. The first one is that when you have liver issues, at the beginning or on stage of liver issues, whether it's hepatitis or fatty liver disease or cirrhosis of the liver or whatever, liver sluggishness, we don't feel the symptoms right away. It is an organ that is so resilient. There's so much your liver can take on before you start feeling symptoms, right? And most often, when you have liver issue, you go to your doctor and you do basic blood tests, these liver enzymes will come back normal. Yes, they will come back normal, right? So therefore, doctors don't focus on liver health unless your enzymes are severely elevated, or when they are touching your stomach, there is enlargement of the liver, or you start having, jaundice, your skin is changing color, or you have ascites, or your belly is, distended because the liver, there's fluid exchange or fluid leaking into your peritoneal, your cavity, the stomach cavity. And then, oh my God, you have liver cancer. You have nodules, right? And then we're all going to go, let's address the liver. The reason why I focus on the liver the most, not my brain, again, not my heart, not my lungs, not my skin. Yeah? Because the liver is the organ that metabolizes everything. The liver is the organ that detoxifies everything. So everything we eat, drink, all the toxins that we get from the environment, from the water that we drink, from the medications, over-the-counter medications that we put into our bodies, from the personal care products, right? These things leak into our bloodstream, and our blood goes straight to the liver. The liver is the most vascularized organ in the body. So when you have all these toxins floating around to your blood, it's going to go straight to the liver. And many of us are not really giving our liver some TLC. We don't, when we should, because we need the liver to work for us in removing the trash, right? There are 3 phases of detoxification that the liver is responsible for: phase 1, 2, and 3. There are a lot of vitamins and minerals and nutrients that the liver needs to get and also produce for it to really do its work, right? And if you have a healthy liver function, you will have a healthy life. Your health will be better. Your skin will be better. You'll have less acne, less issues with your hair falling out, right? You have less dryness, your skin. So I felt like when you address the liver, all the other organs, all the other part of your body, all the other function of the body will be optimized, right? Because the liver is working in removing toxin. If you want to lose weight, you need to address the liver, because many of us are focusing on the other factors of weight loss, but not toxin-related weight gain. If the liver is holding on to toxins and is speaking it back into your circulatory system, and those toxins are being absorbed through, retained to your fat tissues, you're not going to lose weight. If you want to balance your hormones, for all of us that have PCOS, endometriosis, all those menopausal related symptoms, too much estrogen, too little estrogen, like all of these things, all this really need a healthy liver for it to process, right? So if you have estrogen dominance, you need to get rid of all this estrogen through your liver. If you have PCOS, your testosterone is elevated, right? We need to get some of these things out of your body to the liver. If you've taken antibiotic, 1 dose, 2 courses of antibiotic, and you want not to pay for it, you need to detox this thing out of your body. And when we say detoxification, we are talking about the liver doing what it does best, because the liver is the garbage can, right? Like if you think about the garbage can, you need to empty it out, right? If you have a container full of dirty water and you never empty the container and you never clean it out, so you keep putting dirty water, and one day you wake up, you're like, oh, I want to clean water, right? First, you have to empty before you can replace with clean stuff. So before, at the beginning of my journey, I had tons of health issues. I had fibromyalgia. My thyroid wasn't functioning properly. I had skin issues. I mean, if you know me, you might see some of those, scars from acne. I had scars from acne, right? And yes, I did all the things that all of you guys are doing right now, probably did in the past. I've seen the doctors, dermatologists, and I'm putting antibiotic ointment on my skin, and my hair was falling out at my edges. And now the edges are coming back slowly, right? I had receding edges. My edges were falling out because I was not only properly taking care of myself, because I didn't know, like many of you guys don't know, right? You don't know what you don't know. Nobody told me I need to address the stress hormones, cortisol, right? If you have too much cortisol, the liver has to help you process some of that, get it out of your body, right? And the food I was eating was very toxic. I mean, I love carby food. In the morning, I wake up and I would drink coffee. The coffee had mold in it, and mold produces toxins, mycotoxins. Guess what? The liver has to help you address the mycotoxins, right? And I used to put sugar. Sugar is what? Simple carbohydrate, toxic carbohydrate, is the most addictive legal substance on earth. And where do you think that sugar is gonna go? Yes, it was gonna be a boost of energy, but then by 2, 3 o'clock, I was crashing. Or when I go home and I'm like, oh, okay, I'm done. I have no more juice left to give to my family, to my son. So until I started paying attention to detoxifying my liver, because at first I thought going to the bathroom 300 times was detoxification. It's not, it's cleansing, right? I used to drink those things and I'll go to the bathroom, have multiple bowel movements, and I'm like, oh, I'm done. I just addressed my liver. I just detox. Oh, yes. I mean, my belly was flat. I was like, oh, yeah. But I was dehydrated. I was creating more inflammation in my GI tract from drinking a laxative or taking a product that's literally creating tons of inflammation, right? But until I realized, I'm like, what? All right, let me just go back. Let me go back to medical school. Let me go back to learning how do I detox my body. I heard the term detox, like detox, but nobody never told me how to do it properly, right? And I've heard of a lot of detox reactions, Herxheimer's reactions, healing crisis, flu that, like, but I'm like, okay, so I went back and studied the liver. Oh, I said, okay, I need to make sure that I am removing these things. I'm going on a health journey. I understand I have to remove before I can replace with good things. When I studied the liver, I found out, wow, the liver can rejuvenate, right? Regenerate itself, can grow back. The tissues can go back. The liver is responsible for a lot of function in the body, right? And the liver can actually help me with my Epstein-Barr virus because viruses are housed in the liver. If I want to promote digestive health, I have to make sure that the bile, which is the green substance that is produced by the liver, is finding its way to my GI tract and serve as an, detergent, antimicrobial. So I studied the liver. I'm like, okay, what other herbs do I need to really incorporate to help support the liver? And I kid you not, the more I research and learning all the things, I'm like, wow, nobody's telling me this, right? All this Imodium, all the antibiotic I used to take, right? When I had a sinus infection. I remember I had a terrible sinus infection. I was taking Z-Pak. The Z-Pak didn't work, so I went to take Augmentin, amoxicillin. These things didn't work. I'm like, all these things that I'm taking, where are they gonna go? Yes, and over time, it kind of build up. And yes, my liver function tests were normal. They were normal, but I felt sluggish. I felt tired. I'm like, something is off. Where's the energy? I want to have energy. My brain fog was really severe. And I looked bloated all of the time, pregnant all of the time. My muscles were literally spasming from a fibromyalgia, so tender, so painful. Again, all these toxins were leaking into my muscle tissue, my fiber, irritating my muscles. I detox. So I learned about the liver. I'm like, wow, we talk about the heart, right? Pumping the blood. We talk about the lungs exchanging oxygen. We talk about the brain giving us the cognitive function. But all this can be malfunction or not working properly if the liver doesn't catch the toxins. If the liver is puking the toxins back into the bloodstream and we have blood flow all over, right? So when people ask me now, because I am the detox doctor, I promote detox. I feel like after you identify the root cause, which is phase 1, identify the root cause, you need to detox. By detoxifying, you will lose weight, you'll decrease inflammation, you'll boost your immune system. You can even start balancing your hormones. You have better sleep. This is all the symptoms that my patients are reporting to me when they do my detox, right? And what am I addressing when we detox? We're addressing the liver and the kidneys. We're going to talk about the kidneys on the next video. The liver and the kidneys, but mostly the liver. And yes, you might be saying, well, Dr. J, I'm taking milk tussle, I'm taking all this herb food, but there's a difference between supporting your liver and detoxifying the liver. When you support your liver, it's not a powerful It's not as powerful as detoxifying when you're actively doing and removing and pulling the toxins out of your organ. I'm supporting, it's like I'm supporting. The dosage is different. The herbs are not that powerful. I'm supporting versus, oh yeah, I am literally detoxing. Okay. So if you are struggling right now with all things immune system, autoimmune, and you have cancer patients that receive chemotherapy, radiation, right? And you're wondering like, okay, how do I get this thing out of my body? Or you taking any immunosuppressant, biologic medications, you're taking even with metformin, like sugar, right? Like if you are into metabolic syndrome, insulin resistance, and your pancreas keep producing all this insulin and it's not going anywhere. And it's not connecting to the carbohydrate, right? So then you find yourself, your glucose number is increasing, your hemoglobin A1C, like everything's increasing. You need to address the liver so the liver can clear these things out of your body, right? Address the liver, detox. And then after that, you go fixing the root cause of your problem. So the most important organ for me, I mean, you get to choose what's important to you. For me, as a functional medicine doctor, the most important organ, the organ that I'm focusing on the most, right, is the liver. You can do bitters. The bitter is gonna help more with the fluidity of the bile. You can do dandelion. There's so many things you can do. There are like detox tea or liver support tea. You can start drinking if you're not too comfortable with detoxifying, because I wouldn't recommend you detox on your own. But there's so many things you can do. But I am telling you, you need to detox. I detox 4 times a year. And I make sure that the herbs that I'm incorporating are powerful herbs for the liver, right? If you have a nodules, this collection of toxins on the liver. So you need to detox the liver to decrease the nodules, the toxin collection. All right? So I detox my liver and I drink tea, dandelion tea, moringa tea, right? To also support my liver. Okay? So if you find this episode beneficial, please share it with all the people you know. Subscribe to the podcast, subscribe to my YouTube channel. I will be bringing more behind the scenes, vlogging. Things are changing in my life and I want to include you. I want to show you because like you, I thought I'm the only one that's going through a lot of things in my life when in fact, we're all going through something. So if I can share and show you how I get out of it, maybe you can learn a thing or two for you to implement into your own life or bring back to your doctor, to the people that you love, and have them help you or help them. Okay? So thank you so much for watching this. Again, we need your help. Subscribe to the channel. And I can't wait to release the next video. Until then, have a fantastic rest of your day. Stay well and focus on the liver. Bye.